হ্যালো
হ্যালো বলবন্তি, যদি দেখি কোনো কোশ্চেন আসছে না, যে কোনো কারণ নাম দিয়ে বলে দিবি কিছু কিছু কোশ্চেন।
হ্যালো অসীমাদি, গুড আফটারনুন।
তুমি এখন বলেছি সবথেকে বলেছি কোশ্চেন পাঠিয়ে দিয়েছি তো নাড়াচাড়া কিছু
ম্যাডাম মালবিকা ম্যাডাম
আস্তে আইকিউএসি চলছে। হ্যালো অসীমাদি, হ্যালো হ্যালো অসীমাদি,
ওয়ান অফ স্টুডেন্ট বলে দিবি।
এই বাবা,
তুই তো সবার ভালো বলবি, তুই কি নার্ভাস হচ্ছিস?
দিদি হ্যালো হ্যালো, তুই শুনতে পাচ্ছিস আমার কথাটা?
ম্যাম মালবিকা ম্যাডাম ইয়েতে এসছেন, জয়েন করেছেন, একটু কথা বলে নিন।
অসীমাদি,
অসীমা ম্যাডাম
মালবিকা বলছি।
তোর তো এক্সপ্রেশন হচ্ছে, মতো এক্সপ্রেশনও হচ্ছে না।
হ্যালো দিদি, হ্যালো।
ম্যাডাম ফোনে আছে, ফোনে আছে।
তুই স্ক্রিনে থাকলেও তো মনে হচ্ছে না।
আমি তো শুনতে পাচ্ছি না কিছু।
ওকে বলছি, স্ক্রিনে টাইপ করে নিলেও তো মনে হচ্ছে।
তুমি শুনতে পাচ্ছ না আমি কি বলছি? হ্যালো হ্যালো হ্যালো, তোমার কথা শুনতে পাচ্ছি না।
ম্যাম আপনি ফোন করে নিন, ম্যাম শুনতে পাচ্ছে না বোধহয়।
কে আমি?
হ্যাঁ ম্যাম, আপনি ফোনে আছেন? মালবিকা ম্যাডাম জয়েন করেছেন, একটু কথা বলে
আমি
নিন।
দেখেছি, মালবিকা ম্যামকে দেখেছি, কিন্তু আমি তো কারো কথা শুনতে পাচ্ছি না।
ম্যাম আপনার কথা সবাই শুনতে পাচ্ছে,
শুনতে পাচ্ছে?
শুনতে পাওয়া যাচ্ছে ম্যাম। আপনি ওই মিউটটা মিউট আরেকবার করে নিন।
আচ্ছা আমি করেছি, কিন্তু মিউট আনমিউট
একবার করে দেখে নিন ভিডিওটা, মিউট আনমিউট করে একবার করে দেখে নিন।
তুমি তো ট্রান্সফার করবে নাকি?
আমি পিন করব। হ্যাঁ এই যে দেখা যাচ্ছে।
দেখা যাচ্ছে?
ঠিক আছে, আপনি দেখতে পাচ্ছেন তো?
হ্যাঁ আমি দেখতে পাচ্ছি।
ঠিক আছে,
এটা ঠিক আছে বিউজি?
হ্যাঁ হ্যাঁ একদম পারফেক্ট।
স্যার জয়েন করেছেন।
আচ্ছা ঠিক আছে।
দেবারতী স্যার জয়েন করেছেন।
হ্যাঁ স্যার
আচ্ছা,
এসেছেন। হ্যাঁ
আচ্ছা।
ডক্টর দীপেন্দ্র স্যার এসেছেন আর মালবিকা ম্যাডাম এসেছেন, কিন্তু ইউকেবি স্যার এখনো আসেননি।
মালবিকাকে আমি দেখেছি, দিব্যেন্দু স্যার,
অডিবল ঠিক আছে?
হ্যাঁ স্যার একদম অডিবল আর দেখাও যাচ্ছে, একদম ঠিক আছে।
ঠিক আছে, ওকে, থ্যাংক ইউ।
থ্যাংক ইউ।
আচ্ছা আমি অডিবল তো, তাহলে আমি আনমিউট
হ্যাঁ
করব।
হ্যাঁ হ্যাঁ
হ্যাঁ অডিবল।
দেখাও যাচ্ছে।
থ্যাংক ইউ। সরি মিউট করে দেব।
হ্যাঁ মিউট করে রাখ।
তাহলে বিউটি এখন মিউট করে দিচ্ছি।
হ্যাঁ হ্যাঁ
আচ্ছা
স্যার এসেছেন, ইউকেবি স্যারও এসেছেন।
আচ্ছা।
হ্যাঁ স্যার, আপনি অডিবল এবং ভিজিবল। স্যার আপনি ভিজিবল এবং অডিবল, আপনাকে শোনা যাচ্ছে। ওয়েলকাম স্যার।
হ্যাঁ, কিন্তু আপনাকে তো দেখা যাচ্ছে না।
ম্যামরা আছেন, আমি আমি ব্যাকে আছি স্যার। ম্যামরা আছেন, ম্যামরা অন হচ্ছেন কিছুক্ষণে।
আচ্ছা,
Am I audible?
Yes.
yes you are.
Yes, you are audible and visible too.
Thank you.
Am I audible?
Yes ma'am.
আমাকে জিজ্ঞেস করছেন?
না বিউটি।
Yes ma'am. Yes ma'am. আপনি audible and visible.
আচ্ছা।
আমার মাইক্রোফোনটা মুখের ডান দিকে না বাঁ দিকে বলুন তো?
ছবি অনুযায়ী
আপনার ডান দিকে। ছবি
রাইট সাইডে।
রাইট সাইড।
তাই? ঠিক আছে। আমি যে ছবিটা দেখছি আমার সেটা দেখে মিরর ইমেজ।
হ্যাঁ, মিরর ইমেজ হয়। ঠিক আছে, একদম পারফেক্ট স্যার।
আর্তনাদ করে কে?
বিউটি শোনা যাচ্ছে?
ইয়েস ম্যাম, শোনা যাচ্ছে।
বিউটি সত্যি বিউটিফুল।
বিউটি? হ্যাঁ ম্যাম, ভিজিবল অডিবল দুটো।
হ্যাঁ ম্যাম, অডিবল এন্ড ভিজিবল শোনা যাচ্ছে। অ্যাকচুয়ালি ওদের জয়েন করানোর সময় আমার পেজে আমি মিউট অন অফ করতে পারছি না, সেই জন্য।
Is the presentation going to be in English?
স্যার বায়োল্যাঙ্গুয়েজ হতে পারে, ইংলিশে হতে পারে, যেটা আপনার প্রেফার করবেন।
আমি সংস্কৃতে বলতে চাই।
স্যার আপনি বলেন, আমরা বুঝবো না।
তাহলে আপনি তো আমাকে ব্ল্যাঙ্ক চেক দিয়ে দিলেন যা আপনার খুশি তাই দিলেন। আর চলবে কি? কিন্তু বাংলা বললে কি হবে, আপনারা তো ফেসবুকে দেবেন।
হ্যাঁ স্যার।
আর আরেকজন যিনি আসছেন তিনি কি বাংলায় বলবেন?
স্যার জানি না স্যার, জিজ্ঞাসা করছি। কিন্তু দিব্যেন্দু স্যার এসে গেছেন না?
হ্যাঁ এসে গেছে।
অনেকক্ষণ স্যার জয়েন করেছেন কিন্তু
হ্যাঁ স্যার কিসে বলবেন পার্টিকুলারলি?
স্যারকে একবার একটু জিজ্ঞাসা করতে হবে।
হ্যাঁ
স্যার স্যার হ্যাঁ স্যার হ্যালো হ্যাঁ হ্যাঁ আপনারটা হচ্ছে গিয়ে টাইমটা আপনারটা এখানে টাইমিং যেটা করা হয়েছে 3টে কয়টা স্যার ওটা 4:30 4:25 থেকে পরে 4:25-এর পরে। হ্যাঁ পোস্টারটায় হ্যাঁ স্যার মানে যেহেতু ওই স্পেস এখানে তো আর ওয়েটিং রুম করে রাখা যায় না স্যার, এই Google Meet-এ তো এটা অসুবিধা, তো সেই জন্যই আর কি আপনাকে জয়েন করে যাওয়ার জন্য বলা হচ্ছে। হ্যাঁ ফার্স্ট হচ্ছে স্যার আমাদের ইন্ট্রোডাক্টরি পার্ট হবে, তারপর আমাদের আইকিউএসি প্রিন্সিপাল স্যারকে মানে ইনঅগুলার পার্টটার জন্য বলা হয়েছিল, এবার সেটা প্রিন্সিপাল স্যার বা আমাদের আইকিউএসি যে কনভেনার তিনি করবেন। মোস্ট প্রবাবলি প্রিন্সিপাল স্যার আজকে পাচ্ছেন না, ওই কনভেনার যিনি স্যার আছেন তিনিই করবেন। এবার আর যেটা তারপরেই আবার হোস্টিং যে করবে আর কি, সে দেবস্মিতা আমাদের ডিপার্টমেন্টে, সে এবার দায়িত্ব নিয়ে তারপরে ইউকেবি স্যারের ফার্স্ট আর কি টেকনিক্যাল সেশনটা স্টার্ট হবে। এবার সেটা ওরকম 25 মিনিটস অ্যান্ড 30 মিনিটস কোশ্চেন আনসার সেশন নিয়ে। হ্যাঁ তো তারপরে আবার হচ্ছে গিয়ে নেক্সট যে হোস্টিং কো-হোস্ট যে আছে তাকে হ্যান্ড ওভার করে দিলে মালবিকা ম্যাডাম, এবং আপনারটা সেই সেকেন্ড যে হোস্টিং করছে সে করবে আর কি। তারপর লাস্টে ভোট অফ থ্যাঙ্কস। স্যার আপনার আপনি কি বাই ল্যাঙ্গুয়েজে বলবেন মানে নাকি শুধু ইংলিশে, সেটা একবার একটু বলবেন স্যার।
কাকে বলছেন?
হ্যাঁ হ্যাঁ যেটা বলবেন মানে
ডক্টর ভদ্রকে বলছেন না দিব্যেন্দু বাবুকে বলছেন?
আচ্ছা ঠিক ঠিক না 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 কোনো অসুবিধা নেই স্যার। ঠিক আছে স্যার, কোনো কোনো অসুবিধা নেই স্যার। ঠিক আছে হ্যাঁ আচ্ছা ঠিক আছে ঠিক আছে। কি নাম? নামটা বলি। হ্যাঁ হ্যাঁ মেনোকেশন, হ্যাঁ সেটা তো নাম দেখেই করছি। ম্যাম এমন ভাবে ঝড়ের দিকে ঢুকছে, আমি তো স্ক্রিন অ্যাক্সেসই করতে পারছি না, সমানে যেভাবে ঢুকছে আমি মিউটটাই করতে পারছি না। হ্যাঁ আমি করছি না ডিনাই করে দিচ্ছি তো। না 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 এখন আসেন, ঠিক আছে। হ্যাঁ হ্যাঁ হ্যাঁ, এখানে তো আরো জায়গা রাখতে হবে, সেই জন্যই তো।
এখন 3টে বাজে দেখি সব করছে তারা ঢুকে।
আমি স্ক্রিন অপারেট করবো, এইগুলো করতে হবে। তুমি দেখো এটা করে ট্রাই করেই যাচ্ছে। এরকম হলে বিয়ে চলা মুশকিল হয়ে যাবে। আমি স্যারকে ফোন করি একটুখানি দাও। আমি এই বিয়েটা রাখতে পারছি না, ওরা বারে বারে ট্রাই করে যাচ্ছে তো। এই দেখো মেহেন্দি আর্ট করবিস, মেহেন্দি আর্ট সে পর্যন্ত এটা বারে বারে যদি করে যায় আমি তো বিয়েটা করতে পারবো না। এই পেজটা আমার খুলে রাখার কথা, এই পেজটা একবার দেখাতে পারছি। হ্যাঁ স্যার, এখানে তো ঝড়ের বেগে সমানে যে ঢুকেই যাচ্ছে। আমি মিনিটের জন্য একটুখানি স্পেস পাচ্ছি না যে আমি একটু মিউট করবো। এবার এরা যারা করে যাচ্ছে ট্রাই, তারা তো করেই যাচ্ছে ট্রাই, ফলে আমি তো তাহলে স্ক্রিন ইয়ে করতে পারছি না, মানে পেজগুলো খোলা, কিছু প্রেজেন্ট করা, এটা কি করবো এবার? না না, যারা ঢুকছে আর কি, যারা এন্ট্রি করছে, জয়েন করতে চাচ্ছে, তাদের ডায়ালিং মোড এমন, তারা তো সমানে ডায়াল করেই যাচ্ছে, ফলে আমি তো স্ক্রিনের ওপর কিছু করতে পারছি না। এটা এটা গুগল মিটে এখানে ওরা এমন ভাবে ঢুকছে যে এখানে আমি কোনো পেজেরও কিছু করতে পারছি না, যে প্রেজেন্ট নাও বা মিউট করা আমি সেটা পর্যন্ত করতে পারছি না, মানে সমানে করে পাচ্ছে তো, মানে সেটা কি তাহলে? হ্যাঁ মানে এটাই বলছি যে এটা কি করে ইয়ে করবো, আমি তো স্ক্রিন ইয়ে করতে পারছি না, স্ক্রিনে তো কিছু কাজই করতে পারছি না ওরা ঢুকছে বলে। মানে আমার স্পটলাইট তাহলে সরিয়ে ওটা কি করতে হবে, মানে ওরা যেহেতু সমানে কন্টিনিউ পিন করে যাচ্ছে সেই জন্য আমি তো কিছু অ্যাক্সেসই করতে পারছি না, মানে পেজটা তো ওদের যতক্ষণ না ডিনাই করে যেতে হচ্ছে বা অ্যাডমিট করে যেতে হচ্ছে, ততক্ষণ তো আমি এই যে প্রেজেন্ট নাও বা এই যে পার্টগুলো সেখানে তো আমি, কিন্তু তারপরে যখন আমাদের ইয়েরা ঢুকবে তাদের জন্য বাফারিং স্পেস যে রাখতে বলা হয়েছিল সেটা কি করবো স্যার? 89 হয়ে গেছে। দিনেই তো করছি, সেটার জন্যই তো স্যার আমি অন্য কিছু আর অ্যাক্সেস করতে পারছি না। মানে আসলে বুঝতে পেরেছেন তো স্যার, মানে যে আমি যে এক্সিট যে ফুল স্ক্রিন করব বা প্রেজেন্ট নাও করব, এই কর্নারে যে 3টে ডট আছে, হ্যাঁ কানেক্ট হয়ে গেছে, কানেক্ট করে ফেলেছি, ওগুলো সব হয়ে গেছে। হ্যাঁ সব হয়ে গেছে। হ্যাঁ হ্যাঁ, তাহলে আমি সেটা, আচ্ছা ঠিক আছে ঠিক আছে, কারণ ওরা যদি ওরা যদি কেউ বলা শুরু করে দেয়, আমি তো কাউকে পিন করতে পারছি না, মানে আমি পেজের মধ্যে কিছু করতে পারছি না, যেহেতু ওরা ডায়াল করেই যাচ্ছে যেহেতু। ঠিক আছে ঠিক আছে।
কি বলবো?
বলো আপনি ডিনাই করতে থাকুন, তারপরে হচ্ছে যখন দিই ডাটাকে
কি করতে বলবো না?
Yeah, that's because I'm speaking. Am I audible right now?
Yes, sir, you are audible.
Yes, I already said that I'm not audible. If you don't speak, how can you be audible? That's why I wasn't audible, right? Your meeting starts in 1 minute, I guess. It's 1 minute to be o'clock. 1 or 2 minutes.
আর এরা ট্রাই করেই যাচ্ছে স্টুডেন্টগুলোর, মানে এরা অডাসিটি দেখলে আমার
তো এখানে হয়েছে আমার
স্যার ওই জন্য তো পড়ে যাচ্ছে।
Hello. Hello.
Yes, sir.
Are you already joined?
Okay, sir. Thank you so much. We'll start in 1 minute just.
Okay.
চলে আসছে নাকি হবে এটা মাথায় হিন্দু লিখেছে কি বলছো
তিনটে করে না তিনটে পাঁচ
এই
Good afternoon, everyone. I am Devasmita Chatterjee, one of the faculty of Department of Food and Nutrition of St. Anantram Joypuria College. A warm welcome to all of our participants, dear students, respected faculties, professors, and honorable speakers for giving us their valuable time. Today, we have assembled here for a one-day webinar organized by Department of Food and Nutrition in association with Internal Quality Assurance Cell of St. Anantram Joypuria College. And the topic is COVID-19 awareness and dietary modification. We have with us our respected sir and coordinator of IQSC, Professor Dr. Radhanath Pai. Now I am requesting to you, sir, to start our inaugural session. Please, sir.
Thank you, Devasmita. Am I audible?
Yes, sir. Exactly.
On behalf of IQAC cell of St. Anantram Joypuria College, I welcome you all, the delegates and the speaker, in this one-day webinar on nutrition. As we know, the nutrition is a subject which is a very on the go today because of its importance, not only in the pandemic situation but economically too. That is, though we have largest number of productive people of productive ages rather, we can use only 30% of those productive people because lack of nutrition. So nutrition is one of the important aspects in the childhood factor, in the productive factor, as well as in the old age factor too. In addition to that, we are in a very crucial situation today where we do not know what we have to take, what is better for us to share with our family. That means share the foods of our family together. Another important aspect is immunity. We are basically confused by the term immunity today because there are so many prescriptions coming to us that this will increase the immunity and this will not. So we know that micronutrient malnutrition is a very inevitable conditions in our population, which is basically poor, and we want to increase our immunity obviously if it is possible too. I do not know what is possible and what is not. Let us hear it from our learned speaker that what will improve our all conditions, all health conditions in this pandemic situation. Another important aspect which I have to share with you, that is, there may be certain elements which it is better to take as nutritious elements, but we know that largest number of people of our country is moneyless, is poor. So that is also another important aspect, that in cheap, that means in low cost, how the nutrition can be improved. The other aspect that is also important in our sector, in our human capital or the social capital, that is, if nutrition can be added anytime, then why we are also afraid of it? For example, suppose the pandemic situation, if we have to fight with the pandemic situation, then it is necessary that we have to increase our immunity. But why then the sports persons, who has a very highest number of immunity cells in their body, why they are affected with these pandemic situations? So that is also another important aspect, that how far we can go with this immunity puzzle. Rather, I need to say the word puzzle for that. I will request our speaker to speak in a very simple language, so that the non-technical persons like us who are also attending this seminar can have an idea about the nutrition. So I am returning the mic to Deposmita again, and I will always hope for there is a very high success of this webinar, as there will be a question and answer session. At the end of every session, we can interact with the speaker, who will also disseminate their knowledgeable ideas to us. So, Devosmita, with these words, I am returning the microphone to you. Thank you.
Thank you, sir. Thank you so much for your valuable and kind words. And now, I would like to address our HOD Madam, Professor Devaroti Das, to illustrate today's topic and its relevance with the present scenario. Now it's over to you, ma'am. Please.
Thank you, sir, and Devosmita. A very inspiring, nutritious afternoon to all. One should never underestimate the importance of eating healthy food. Eating healthy food means we can better fight diseases and live longer. When it comes to happiness, studies have shown that eating healthy is an excellent natural antidepressant, and it also increases the energy level. But nutrition does not only include good food, it also embraces the hygienic aspect that is to be taken care of. So I really feel that today's webinar is not only thought-provoking, but it's very much relevant to the present scenario. Our eminent speakers, by their valuable speeches, would not only guide us, but would help us to stay healthy and fight COVID with strong hands. Thank you, everybody. Now I'm handing over to Professor Devasmita Chatterjee in order to conduct the first technical session. It is over to you, Devasmita.
Thank you, ma'am. Now we will start our first technical session, and I would like to welcome Professor Dr. Utthal Kumar Bhadro. Professor Utthal Kumar Bhadro is a stalwart in the field of community medicine. He is at present associated with Nobel Medical College in Nepal as Professor in Community Medicine. He was also former principal in Calcutta Medical College and Belghata ID Hospital. He was also associated as a visiting professor in Department of Food and Nutrition, University of Calcutta. Students from different institutions have been enriched by him. Today he will deliver his speech on COVID-19 control and public responses. Please, sir.
Thank you. Actually, it will be in the form of a short presentation because I have only half an hour to speak, along with my question and answer sessions. So let us, instead of spending a lot of time on talks, let's go straight to the presentation right now. Is the presentation visible to you all?
Yes, sir.
Yes, sir. Yes, sir.
Okay.
Yes, sir.
Is it visible in full screen to you all?
Yes, sir.
Right. So the first message I want to you is that you don't need to panic. The first message that I would like to give you is that you don't need to panic. There's a lot of panic all around us. I understand that.
Sir, your
Because
presentation is not visible, sir. Sir, your
Yeah.
presentation is not visible.
You can't see the presentation, the slides.
No, you are visible, sir, but your presentation is not visible.
I am visible. Am
Yes,
I
sir.
visible now?
Yes, sir. Yes, sir. You are visible, but the
The
presentation is not.
presentation is not.
No, sir.
What about now? Do you see the presentation? Hello?
Yes, we can clearly see your presentation.
You can see the picture, the coronavirus disease.
Yeah.
Yes,
You,
sir.
you, you can
Yes,
see
sir.
it, all of you, right? That's what I was talking about. You don't need to panic. So let's go to the next one. The name of the disease is actually severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. As you can see, it's an abbreviation of the entirely big name. So it causes the disease which is named COVID-19. COVID-19 is the name of the disease, and the name of the virus is SARS-CoV-2. It's a new virus, and it appeared first in Wuhan in China in late December of 2019. Because it was discovered in 2019, we call it COVID-19. This is the short timeline of the COVID-19 pandemic. You see, it started in December 18 when some cases appeared in China, and it travels through December 31, January 12. These are the timelines which are written. You can see that on your screen. And then on January 30, after 12 days, the first cases appeared in China. After 12 long days, the WHO declares a public health emergency. Not before that. Some say that it's been a dereliction of duty on the part of the WHO, but we won't go into those things right now. Incidentally, this January 30 is the first case in India. And then on March 11th, a global pandemic was declared by WHO. That was such a long time after the December 18. And then in March 13, we have a state of emergency declared by the WHO. How is it spread? As we know by now, it's a droplet infection. People get infected when they get these droplets into their nose. When somebody's with the virus sneezes or coughs, and there are droplets released, and they get those droplets into their nose, eyes, or mouth directly. That's how people get infected. Or when those droplets fall on something, some other inanimate object like tables, like other things like doorknobs, and when you touch those contaminated objects and touch your face, you get the virus. So it's a upper respiratory virus, and you get it by this means. This is the long and short of the transmission of this. The burden of infection is quite tremendous right now. Robert Redfield, director of CDC Atlanta, that is the Center for Disease Control in Atlanta, he said while meeting the press in the White House that he said that our best estimate right now is that for every case that's reported, there actually are 10 other infections. So, if India right now has 19 lakh cases, that is actually 1.9 crore people are infected. That's what it means. It may be true. And the burden of infection can be clearly understood from this picture. You can see at the top of the triangle is the confirmed deaths. It's a graphic from Italy, from the experiences in Italy. The confirmed deaths are at the top, and below that is the confirmed cases, which are much bigger than the deaths, of course, because not many people are dying. Right now, the death rates even are coming down. And all infections, you see, it's a huge number. All infections. That means there are so many infected people who haven't been tested, about whom we don't know anything about. They are moving around. And that's what constitutes this epidemic. these are the symptoms. You can see that. We have fever in about 27% of cases. We have dry cough in about 21% of cases. That's our experiences in dealing with this disease here. We have sore throat in 10% of cases. We have breathing distress, yes, as 8%, and extreme weakness is 7%. This extreme weakness is a funny thing. The person feels that he won't be able to stand unless he's supported by somebody. In all other appearances, he might be okay. He may not have anything other than extreme weaknesses. That's the thing. What separates this infection from other similar infections of the upper respiratory tract is that the patient may not have anything but still be infected. We have estimated that around 70 to 80% of all infections go unnoticed. They don't know themselves that they have the infection. I have seen cases like that. They are testing positive, but they don't have any other symptoms. After extreme weakness, we have diarrhea in a very low number of cases. Just there may be diarrhea and no other indication. And there may be, and that's peculiar, loss of smell and taste. That's peculiar, but that is very diagnostic of this. And there may be headache, body ache, and then nausea and vomiting, all these things. So out of these symptoms, we estimate that if we have at least 3 of them, any 3 of them, we will be sufficiently convinced for all practical purposes that the guy has got coronavirus infection, COVID-19 disease. 3 out of these 9, out of this whole list of these things. That's our knowledge. Right. And this is the timeline what we have observed in Kolkata as well as from other national and international experiences. Let's follow the timeline a little bit. The numbers that you can see on the top and on the bottom are the number of days. On the 0 day is the day of the infection that comes to you, to me. And that's day number 1, 2, 3, 4, nothing. There is no problem, no issues. The guy doesn't feel anything. And then on about the 5th day, or a little bit thereafter, on about the 5th day, we have these symptoms. Not all of them. Maybe 1 or 2 of them. Maybe 3 of them. Maybe 4, 5, 6. Okay. We don't know. But some of them appear. See, fever, dry cough, sore throat, diarrhea, extreme weakness, loss of smell, taste, and then headache, body ache, nausea, and vomiting. All these things are coming. But breathlessness usually does not occur from the outset. Breathlessness usually is not the presenting symptom, unless, of course, the person has forgotten that he had other things before, or the other things were so mild that he never thought about that. So breathlessness comes on the next day, maybe 1 or 2 days later. That's called dyspnea, here in this picture. After dyspnea, you should be careful, because there's the time to take care of this guy, because he's got, dyspnea means he's got a problem with the gaseous exchange in his lungs. You know, in lung what happens is that the carbon dioxide from the blood is taken out and oxygen from the air is pushed in through a very fine membrane, the alveolar membrane, which is at the periphery of the lung, in the lung tissue. There are air sacs which are called alveolus, you know all that. And the alveolar membrane through which this gaseous exchange takes place, and this alveolar membrane is getting jeopardized, is getting thickened, is getting unable to exchange the gases. That's how your oxygen tension in the blood starts decreasing and you start feeling breathless. But there is one thing very peculiar in coronavirus infection is that we have seen the oxygen tension in blood is usually between 95 and 100 or 99%. We can measure that with the help of a small machine, small instrument, small equipment. You can see a picture. It's called pulse oximeter. It's put on a finger, preferably the middle finger of your right hand. When you do that and put it on, you can see these things are coming. The PSO2 readings are coming. Out here you can see that it's 94%. It's a bit less than what it should be there, and it should alert you that something is happening. But then you must also understand how the pulse oximeter works. It's an external machine. It is not invasive. It doesn't have any contact with your blood. It just senses from across the skin. So you have to give it a little bit of time and not move around your finger. Give it a little time to settle down and then see the reading. And the other reading which you can see is the pulse rate. Pulse oximeter is a very small instrument and not very expensive. It's available from 500 rupees onwards up to 5,000. They are all okay. It's possible to use it efficiently in the management of your COVID patient. Okay, so what I was trying to tell you is that this dyspnea occurs quite late in case of a COVID person. When the PSO2 or this oxygen saturation in the blood goes up to 94, the person doesn't feel anything. It goes up to 93, it doesn't feel anything. 92, 91, 90, he may not feel anything. Contrary to what happens in otherwise in acute respiratory distress syndrome and other patients of COPD, chronic obstructive pulmonary disease, and other patients. So this period when the person should be feeling breathless but does not, we call that period happy hypoxia. Happy hypoxia. We call that period happy hypoxia because the patient is hypoxic, unable to take oxygen, but still he's happy because he doesn't feel it. You must understand all these things. These are all common knowledge and these are all manageable in the public level. The doctor is not necessary to understand that the pulse oximeter reading is less than 95. It's coming down quickly and we must hospitalize the patient for oxygen inhalation and oxygen administration. So after that dyspnea, then comes a stage of admission. A little bit later, maybe on the 8th day or 9th day, there is this admission. And then after that, there is the period of on about the 8th day, between 8th and 9th day, usually there is severe dyspnea sets in, severe breathlessness. That's an emergency. That's why the patient has to be given very high flow oxygen and it cannot be done at home. A little later, if the condition deteriorates further, the patient has to be taken into an ICU and managed. So this is the timeline, the COVID timeline that we have seen in our state and also elsewhere in India and probably internationally. So this is by and large the same. Now, these things appearing, just a moment please. Okay, sorry for the interruption. So this is the COVID timeline. I hope this is clear by now what the timeline is like. Can you see the presentation? Hello?
Yes, sir. Yes, sir.
You can see, right? So this is the pulse oximeter for you. It's a magnified view of what I've been showing in the earlier slides. This is the pulse oximeter. It measures the saturation of your oxygen tension in the blood. You can see that the PSO2 reading is 94 and the pulse rate is 86, a bit high on the higher side. As I said, it costs between 500 rupees to 5,000. You don't have to go for very high-end machines. Now, what can we do when you get a patient like that? Ideally, the patient has to be treated within 5 days of the appearance of the symptoms. Within 5 days, you understand that? And specific treatment is given in the ICMR recommendation. You know ICMR, Indian Council of Medical Research. It's a very big scientific body and it has got absolute treatment jurisdiction in this epidemic. For your information, in this epidemic right now, we have this Epidemic Diseases Act 1897 in vogue, and that gives ICMR the absolute power to formulate therapies, formulate treatments, formulate advisories, which you have to consider and do and abide by. So the treatments are given in case of mild and moderate cases, especially the mild ones, because those are huge in numbers. For fever, you can give paracetamol and hydroxychloroquine, a drug. It's an Indian drug. It's being exported all over the world right now, and ICMR has recommended, based on various studies that they have gone through, this is the hydroxychloroquine dosage that they recommend. Now, since this is not a technical sort of thing about treatment and other convoluted aspects, I'm not going further into the treatment protocols beyond mild. I'm not going into moderate or severe cases, but this is the mild cases that's in the community. As I said, this disease can be diagnosed by means of the syndromes, the appearance of those syndromes, and also by testing. RT-PCR testing is there. Now, testing is not available for everybody. Everybody who is having cough or is having fever cannot be tested, because you cannot think about the cities only. There is a vast number of places which are not cities. India is about 75% villages and 25% cities, towns. So you have to think about the entire India, the majority of where the people live in rural circumstances, and testing is not very well available in all these places. So the syndromic approach is the thing. As far as the epidemiologists are concerned, their opinion is that when you have a syndrome of at least 3 of those symptoms in somebody, you surmise that it is high probability, because it's an ambience of epidemic, there's a high probability of him or her being a COVID-19 case, and therefore the treatment has to be given. If you give the treatment within 5 days, you can render the patient quickly non-infectious. Person will be unable to spread it. And that's how you can slowly control the epidemic. That is what I've been talking about, the syndromic treatment for COVID-19. That is what the epidemiologists all over the world advise. Professor Harvey Risch of America, in a public school of Bloomberg Public Schools, Professor Harvey Risch, he has said that COVID-19 should be treated in all outpatient departments. For example, here, it should be treated in all clinics of the Purushabhas, all the clinics of the hospitals, all the clinics of the all the OPD clinics of the private nursing homes and private hospitals and government hospitals. So, this is because of the urgency of this endemic situation. This is a recognized mode of treatment. And this is again a list of the diseases, list of the syndromes, symptoms, that we can see in a patient of COVID-19 disease. Now, there has been a little bit of controversy about that. The professor also said that we need to improve our immunity to fight the disease. The treatment is there, of course. The treatment is there with hydroxychloroquine and other medications. Treatment is there. But then, so that you do not catch it, to prevent it, what can you do? Well, these are the time-honored treatments. These are the time-honored nutritional elements. And since I'm talking to a whole bunch of nutritional experts out here, I don't have to, elaborate on the necessity of all these things. Vitamin C, for example, I cannot finish my lecture in 1 hour if I talk in length about vitamin C. These are some of the research papers which have come out. At the top, you can see vitamin C can shorten the length of stay in ICU, a meta-analysis. It is true. Vitamin C has been given in high dosages, intravenous vitamin C also. It has a very good therapeutic approach. Can vitamin C protect you from COVID-19? You bet it can, because it increases your immunity, increases your fighting power. Critical care alert reviewing the experience or evidence of citrus study. You can see that. Now, these studies have all demonstrated its efficacy in reducing the stay in an ICU environment, intensive care unit environment. Vitamin C. So, vitamin C is something that you should take regularly. We should all take regularly and consistently. How much? We'll come to that. Then vitamin D. You can see, again, we have given you a couple of study reports. In the Trinity College, there was a study of vitamin D could help fight off COVID-19. That is the new Tilda research. It's a conclusive research that vitamin D could help fight off coronavirus infection in human beings. You may be infected, but the effects of the infection will be a whole lot less if you have sufficient vitamin D in your systems. Attenuation of influenza-like symptomatology and improvement of cell-mediated immunity with long-term N-acetylcysteine treatment. So, this is about N-acetylcysteine. And again, vitamin D supplementation to prevent. That's another meta-analysis from the British Medical Journal. They can say that vitamin D and N-acetylcysteine, they are all nutrients which you should have and which you should not be deficient in if you have to successfully fight COVID-19, even if it infects you. So these are the evidences. And zinc, we have zinc. These are the two papers I could find on the spot at the moment to say that. The first one says that zinc has got in vitro action to kill the viruses. You know what happens? Of course, you know all that. Zinc usually is extracellular, and the virus replication occurs inside the cells. It's intracellular even, and something called RNA-dependent RNA polymerase (RDRP), which is responsible for viral replication, is inhibited by zinc. So zinc actually inhibits viral replication inside the cell, but zinc usually resides outside of the cell. So how?
Hello.
Yes.
Hello.
Yes.
We are not getting your slides.
What are you? You are seeing me.
I am saying you, but not your slides, which is very important.
What about the other? Somebody they said that I don't understand this. I was
Your
informed
slide
that
is visible.
slides are there.
Your slide is visible. Everyone can see.
Slide is visible.
Yes, yes.
Okay. Then continue. Then there is my problem.
Yes, sir. The slide is visible to all.
Sir, you may pin on this slide also, then you can see it.
IQSA, it is coming.
Sir, the slide presentation, Professor UK Hodro,
Yes.
you may pin on them and you can see it.
If I pin them, they can see the slide?
No, sir. Rather not fine, sir.
Yeah. So, do I continue? This is about zinc. I was talking about zinc. Zinc is extracellular. So how do you put zinc from the outside of the cell into the cell? And that's where a zinc ionophore comes. To the nutritionists out there and my audience and listeners, I don't have to elaborate on that. The zinc has to be transported into the cell by means of with the association of something called a zinc ionophore, which are the other molecules other than zinc. The chloroquine, hydroxychloroquine are very, very good zinc ionophores. They transport the zinc inside the cells, and zinc then stops the replication of the viruses. Chloroquine and hydroxychloroquine has other means of killing the virus extracellularly or even endocellularly by altering the pH of the endosomes and things like that. Now, this is where zinc comes in. So zinc as a nutrient we should not be deficient in. Should you take zinc? Zinc, yes, you bet you should. And then there is something called quercetin. You all know quercetin is a dietary constituent which is abundantly available in onions, things like that, and rasuns, piyaz, things like that. So quercetin is also a zinc ionophore like hydroxychloroquine. There are a couple of studies I could find. Zinc ionophore activity of quercetin. Quercetin as an antiviral agent, it inhibits influenza A virus entry. Now, quercetin is another constituent of diet that you can advise to other people for improvement of their nutritional status and also for improvement of their chances of not getting infected or getting milder disease if they do. And then, of course, you might not consider sleep to be a nutrition, but then sleep is something that your body direly needs to fight off the infection. There have been a lot of studies on sleep and its patterns. This is a very important study which you can see in this thing. The link is there, of course, and it proved conclusively that sleep between 10 p.m. and 1 a.m. is most immunogenic. Would you believe that? I do believe it, because you can go through the study and find out for yourself. Sleep between 10 p.m. and 1 a.m. Actually, they recommend that the total sleep quantity at night should be about 7 to 8 hours. And then you can fight corona brilliantly. Do I sleep for 7 and 8 hours? Try to, but not always. This is because the civilization is becoming more complex. WhatsApp, Facebook, and all these things coming over, and the sleeping time is delayed, and getting time is earlier because of the traffic. We have to get out and negotiate the traffic and reach our workplaces. So sleep time is reduced, but that's not good. That's a bad effect of civilization. So for protection in this pandemic, I take, no compulsion of any of you, I take HCQ as far as the recommendation of ICMR, Indian Council of Medical Research recommendation. As a health worker, as a health professional, I take it 400 milligram once a week after food. HCQ. HCQ has been the subject of an unnecessary controversy, which I don't need to go here because I don't have the time for that, but there may be a different session on that aspect again. HCQ. And then vitamin C, the recommended daily allowance is 70 milligram per day, but 500 milligram tablets are available in the market. It doesn't matter. A little bit of extra doesn't matter because vitamin C, that it's a water-soluble vitamin. And then zinc, the RDA is 40 milligram per day. Should at least take that. Of course, you get it from your diet, But then you should take extra precautions and take about 30 or 40 milligram of zinc nowadays. Don't increase it too much because then it will interfere with your copper mechanism, copper absorption, things like that. And then vitamin D, you bet. I do take it. About 2,500 international unit per day. Or if I get a hefty sunlight on my roof, I take that for 10 minutes. That will be sufficient. But not all of us can get the sunlight or want the sunlight. Then, of course, you have quercetin. It's an OTC drug. I take it at the rate of this 500 milligram BD. That's my schedule. And then sleep 7 to 8 hours. I honestly try to do that. I try hard, very hard. And then N-acetylcysteine. It has been shown that N-acetylcysteine also performs brilliantly in fighting off upper respiratory and lower respiratory infections. And the dosage is 600 milligram BD twice daily. I take that. That's about, for protection of pandemic, what I do. And then prevention, of course, you all know that you should all wear masks so that the droplets are spread out much less and you are safe from all sides. So wear mask. Physical distancing of 6 feet, at least 6 feet, is recommended. Wash hands up to your elbow with soap and water. It is not necessary to use sanitizer all the time. If you have sufficient water and sufficient soap, access to all this. If you do not have, then only you should use hand sanitizers. And the treatment of cases. The quicker you treat the cases, the quicker you make them non-infectious to the community. And they will not be able to spread it anymore. And of course, there is the question of vaccine, which is a topic by itself and should be discussed over 1 hour. But in short, I can say that there are 205 vaccines are being developed, and 19 of these are into human trials. And within the next 6 months, you will get about 6 or 7 vaccines. We don't know how much effective they are. They say that they are, eliciting antibody responses. But antibody responses are elicited even a small ant bites you and puts something in your body, and antibodies are generated for that. So antibody response is no deal, not a big deal. The question is, do they give immunological memory so that after years, after a long time, when the virus or bacteria actual thing comes, the body recognizes it and produces its own immune system? We haven't had enough time to test these vaccines. We don't know how far they will be effective in the long run. For influenza, we have vaccines, but these vaccines change every year. So taking a vaccine every year, okay, when I was a little boy, I had tetanus, I had BCG, I had triple antigen, and I am not taking them throughout our lives, all these vaccines. They only have taken a couple of times and it's over. An ideal vaccine is like that. Okay, let the vaccines come and then we shall see what to do about that. So, this is all about vaccines. Now, my presentation is actually finished and I would welcome questions from you. I have only about less than 5 minutes for the questions, right? Thank you very much. Now please ask your questions.
Thank you, sir, for your valuable lecture. The guidelines and information provided by you will help us to fight with this situation.
Sure.
We have received few questions from our participants, and now I would like to present those questions to you, sir.
Yeah, but can you see me now?
Yes, sir. Absolutely.
The presentation is gone from your screen, is it?
Yes, sir. Yes.
All right, fine. Sure.
The first question is from Aim Day, and the question is, can we take zinc tablet to build immunity in our body?
As I say, zinc itself doesn't work. Of course, you should have for other bodily metabolic purposes, and as nutritionists, you know all that thing. But for coronavirus infection, zinc has to be supplemented with a zinc ionophore. Otherwise, zinc doesn't travel from the extracellular fluid inside the cell. A zinc ionophore has to be taken. I have discussed two zinc ionophores in my lecture. One of them is hydroxychloroquine, and the second is quercetin. So, taking only zinc, well, it's a nutrient, and the nutritionists will always say, yes, you should have sufficient zinc in your body, and if you are deficient, you should definitely go ahead and take zinc.
Okay,
Does it
sir.
answer your question?
Okay, sir. Yes, sir. Next question. May I go?
Yeah.
Okay, sir. Apart from getting these vitamins from the diet, if we take supplements, will toxicity of these not occur in our body?
Okay. The vitamins, not vitamins, the nutrients, which are water soluble, the chances of toxicity is much less. For example, vitamin C excess, it will not mean anything. It will only make your urine acidic. And if you take medications like cotrimoxazole, Septran, like that, they might form crystals in your body. Cotrimoxazole is not used any longer nowadays, so it's not a big deal. And about zinc, I have said, although zinc salts are water miscible, water soluble, you should not take too much of zinc. If you do, then copper metabolism will be hampered. So you have to take copper also at the rate of 1 milligram copper for every 15 milligram of extra elemental zinc. And vitamin D, yes, it's not a water soluble vitamin. It's a fat soluble vitamin, and it does tend to accumulate in your body. Excess of vitamin D is bad. If you take 10 minutes of hard sunshine in your full body, and then go on taking 2,500 international unit of vitamin D, it might be come across an issue. You shouldn't. So, but nutritionists agree that in any case for sedentary Indians, about 2,000 international unit daily as a supplement is okay. It's no problem. Next question, please.
Okay, sir. The next question is from
Look at your
Devendra.
watch. There is no time. My time is finished.
How COVID can be arrested at community level?
As I said, the prevention of COVID consists in wearing the masks, as I said, maintaining distances, washing your hands frequently, and be careful about your surroundings, and treatment, because there are so many COVID cases. As they go by, you will see your state and your India, your country will make records in number of infections. Every day you will see the নিউজ চ্যানেল সে আজ রেকর্ড করলো মৃত্যু আজকে এত ছাড়িয়ে গেল আজকে এত কেস ছাড়িয়ে গেল দ্যাট ইজ the hallmark of an epidemic. What else do you expect in an epidemic? Epidemic will spread. This is a particularly very hugely spreading disease, so you will come across cases all around you. So you have to treat them as you get them. You can't wait for testing. That's a view of an epidemiologist like me, an international view. But what is happening is different, maybe later. But you have to catch hold of them and treat them at the community level. My request to all the community practitioners, the private practitioners in all the hospitals and all the municipal clinics, do treat them. If you cannot test all of them, but give them treatment with hydroxychloroquine and zinc and vitamin C and vitamin D. Next.
Okay, sir. Sir, last question. Is it necessary to take HCQ tablets?
What do you think? See, it has been recommended by ICMR for frontline healthcare workers or people who are at risk of developing the infection. If you come across or if you are caring for a COVID-19 patient in your home or in the community or elsewhere, or you work in a hospital caring for COVID patients, then the ICMR has recommended taking HCQ tablets because international results and Indian studies have shown that HCQ as a prophylaxis is preventive. It does work as a preventive. The prevention efficacy starts coming after the fourth dose, and after the sixth dose, the efficacy is 80%. Whether you should take it or not, up to you. If you feel you are threatened by COVID 19, you should. If you feel you don't have any such threat, okay, no issues. I take it.
Okay, sir. Thank you so much.
You're most welcome, ma'am.
Thank you. Thanks again, sir. Now we are moving to our second technical session, which will be conducted by Professor Madhumanti Goswami, another departmental faculty of Food and Nutrition Department. Now it's over to you, ma'am.
Thank you, Professor Chatterjee, and good afternoon, everyone. It's been almost more than 5 months that COVID 19 hits the country. And as on today, 9th August 2020, we have more than 20 lakhs confirmed cases and nearly 42,000 deaths. Now it's a novel coronavirus, never seen before. And in this pandemic scenario, we are getting so much information from multiple sources regarding the virus, its vaccine development, medicines, dietary guidelines, immunity boosters, and so on. Now, these facts are also evolving over time, and sadly, some are misleading too. Here in this surrounds, I would like to invite our next eminent speaker, renowned dietitian Mrs. Malavika Datta, to deliver her lecture on this. Being a clinical dietitian, she is having 13 years of expertise in healthcare sector. Earlier, she was associated with reputed hospitals of Kolkata like Ruby General Hospital and Tapan Sinha Memorial Metro Railway Hospital. Currently, she is holding the position of chapter convener of Indian Dietetic Association IDA Bengal chapter and HOD of Dietetics and Nutrition Department Kothari Medical Center. She also trains the students of various educational institutions as a guest faculty and also is involved in numerous nutritional programs through health-based workshops. Welcome, ma'am, to our second technical session, and it's over to you.
Thank you, Madhumanti, for the introduction. And
Ma'am, may I present your slide?
please, I am very much thankful to all the fraternity of Food and Nutrition Department and the Principal Sir of Sheikh Anandaram Jaipuria College for inviting me as a speaker. Today, I am going to discuss on a very interesting topic, and it is very much relevant of current scenario, that is fight corona and rich nutrition. Next slide. Next slide, please. COVID-19 is the pioneer problem for public health. In this pandemic situation, we have to maintain a immune boost healthy lifestyle in all age groups. Entire mankind across the globe is facing the threat, while there is no medicine for it as of now. It will be good to take preventive measures, as we all know preventive measures is better than cure. So as a dietitian, we would like to bring nutrition to the rescue of human being by throwing light on empowerment, the body's natural defense system, that is immunity, and fight against virus by maintaining optimal health. Next slide. So why is it important? The weakening of the immune system leads to a greater susceptibility and awareness to various infections like respiratory system infections, herpes and fungal infection. So a healthy lifestyle we should maintain through eating a balanced diet, no smoking, in taking of no alcohol, sleeping well, taking regular moderate exercise like yoga, free hand exercise,
brisk walk, and reducing the stress level. This is very important. So boost our immune system to be in the best shape possible to fight against pathogens. Next slide. So what is our dietary goals? Through balanced diet, we reach our dietary goals. So first, maintenance of a state of positive health and optimal performance in population at large by maintaining ideal body weight. We dietitian, we all know how to calculate the ideal body weight. Through Broca's index, we have to calculate the ideal body weight. And ensuring adequate nutritional status for the pregnant women and lactating mothers. These both phases are very much important for maintaining the proper nutritional status. Improvement of the birth weights and promotion of the growth of infants, children and adolescents to achievement of adequacy in all nutrients and prevention of deficiency disease. Prevention of chronic diet related disorders, maintenance of the health of the elderly and increasing the life expectancy. So now, what is healthy diet? A healthy diet helps to protect against various non-communicable diseases like diabetes, cardiovascular disease, chronic respiratory disease, cancer, and as well as all forms of the malnutrition. If we don't follow the proper healthy diet, we are prone to this type of communicable disease and also the malnutrition. Healthy dietary practices should be start from the early in the life. Exclusive breastfeeding helps to improve adequate growth and improper cognitive development. This is very much needed. Now, this month, the first week of August, we are celebrating World Breastfeeding Week, and we are aware the mothers. You have to feed your baby only mother's milk. Exclusive breastfeeding, it helps to improve your baby's proper growth and immune system. This is so important. And energy intake should be in balance with energy expenditure. This is very much important thing. To avoid unhealthy weight gain, total food consumption should not exceed 30% of the total adequate calorie. We will go for the unsaturated fat instead of saturated fat and trans fat. A part of healthy diet should be intake of free sugars less than 10% of the total calorie. This is very important thing. Don't take excess level of sugars. Sugar contains only calorie, nothing else. So don't take excess sugar. Keeping salt intake always less than 5 grams per day. This is also very important. Don't take salt-rich food like any kind of junk food, fried food, bhujia, chanachur. This is very much salt-rich. This is not good for us. So we have to take the good salt diet, and that will be prevent for the hypertension and reduces the risk of heart disease. Now, this is the picture of food pyramid and my plate method. We all know about the food pyramid. We have to follow the everyday menu planning like food pyramid. That is cereals, pulses. After that, I explain the 5 food groups. You all know about the food pyramid, and this is the my plate method. This is very important. You see, the half portion of the plate is should be filled up fruits and vegetables, and half plate half portion of the cereal and half portion of the pulses, nuts and seeds and fats and oil. You have to follow this my plate method in your everyday meal plan. Next slide. So now the slide is important. Through balanced diet, what food we are eat, the food should be in that 5 food groups. Then all type of nutrients we are getting. So cereals, pulses, vegetables and fruits, milk and its products like tuna, curd, paneer, cheese, and egg, meat and fish, oils and fats, and all kind of nuts and oilseeds we have to take every day. We all know what are the energy giving food like grains, millets, starchy vegetables and sugar. They all are energy giving foods. Presently for COVID-19 we all are in home. That's why we put on our weight, and through internet we know about the keto diet. Then we follow the keto diet and we discard the cereals, discard the carbohydrates. Don't do that. You have to take energy giving foods like grains, millets, starchy vegetables and sugar. And also we know what are the bodybuilding foods. Pulses, dairy and dairy products, eggs, any kind of non-veg like chicken, fish, meat, all are first class protein and they are the bodybuilding foods. And the fruits and vegetables, they are rich in lots of vitamins and minerals. They act as protective foods. Nowadays, we are very much needed vitamin A, vitamin D, vitamin C, vitamin B complex, and also the zinc, magnesium, and selenium. All are present in various proportion in our 5 food groups. So we have to take in balance and right proportion in our everyday diet. Next slide. This is the 6 age groups of very important of 6 age groups. Number 1, infancy, pregnant and lactating mother, preschool children, school going children, adolescent and elderly. They are the very vulnerable group and they have to follow the proper balanced diet and proper lifestyle system they should follow. Next slide. Now this is the slide. What are the recommendation of the all the nutrients like carbohydrate, protein, fat, calcium, iron according to ICMR 2010. We all know about that. Next slide. Now, this is one of the very important slide. The dietitian, when we plan the diet planning, we keep in our mind there should be variety, should be present in our diet planning, and also that is the seasonal foods. Also, what are the locally available foods? That is very important. We know this is very nutrient rich. You should follow that. But no, what are the available of the locally? This is important. What are the traditional recipes? What are the traditional cooking practices? And also avoid all kind of processed food, ready to eat food. This is not good for us. Adding healthy fats and avoiding processed fats like Vanishpati, DIETARY, and highly refined and saturated fat. Don't take this. And good hydration. This is very important along with diet. Hydration is very much needed. And discipline exercise, avoid overeating and undereating, and with the help of dietitian, you know your exact portion, how much calorie you are needed, how much carbohydrate, protein, fat are needed. You should consult a qualified and experienced dietitian. Maintain a balance in good lifestyle by exercise, yoga, meditation, good nutrition, sleep and hydration. If you follow this in proper way, you have to maintain your good health. Next slide. Next slide, please. Now, what is the importance of nutrition? If your nutrition is improper, then your immunity power will be low and you may develop the increased risk of the disease. So, you have to take the proper nutrition to develop your immunity system. And infectious diseases, to combat infections, nutrient requirements go up and the intake goes down, and that may result malabsorption. So nutrition is the very important thing to fight coronavirus. Next. Now this is very controversy. If mother affected with coronavirus, then what she should do? Breastfeeding safe during COVID-19. If the mother has COVID positive or suspected, then mother can spread the virus to her infant through tiny droplets that spread when she talks, cough and sneeze. But coronavirus has not been found in breast milk. So mother can give the milk with proper system, and she should wear the mask and sanitize properly. Exclusive breastfeeding for first 6 months protects newborns from infections throughout the infancy and childhood. And through breastfeeding, that will increases immunity and provide antibodies to the child through the mother. Next. So what are the immunity boosting foods? Omega-3, one of the immunity boosting nutrients that will come from flax seeds, almonds, walnuts. We can take every day 2 teaspoons flax seeds and also 4 to 5 pieces of almonds and walnut 1 to 2 numbers per day. Through this we can take the omega-3. And also the protein is very important. Protein is help for the immunity power. Low fat milk and milk products 2 to 3 servings per day. That means 300 to 400 ml per day you can take. Fish or chicken 200 grams per 2 to 3 times a week. You can take 3 days fish and 3 days chicken. And eggs you can take every day, 2 egg whites or 1 whole egg per day. It's like so these are some pictures of omega-3 rich foods. We also take the omega-3 from various kinds of nuts and the pumpkin seeds. This is the very rich source of the omega-3. Next slide. So these are some pictures of proteins. We have to take both sources of the protein, veg source and animal source. Veg source like pulses and legumes, we can give the protein like moong dal, mushur dal, chola dal, motor dal, rajma, soybean, beans. That all are very good source of protein. And from animal source, milk and milk products, curd, chena, paneer, egg, fish, chicken, we can take every day in a proper amount. It helps to combat diseases, wound healing and early recovery. Next slide. Now the vitamins. Vitamin can act as hormones and antioxidant, promoting differentiation, proliferation and signaling. It may also be essential to the function of immune system, helping to balance inflammatory and suppressive responses. So we have to take vitamin A. Vitamin A helps to protect by keeping skin and tissue in the mouth, stomach, intestine and respiratory system healthy. We get the vitamin A from yellow, red, any kind of yellow, red color. Fruits and vegetables are rich source of vitamin A, like carrot, pumpkin, mango. You can take any kind of fruits and vegetables for a vitamin A. For vitamin D, vitamin D helps antimicrobial effects, reduces the body inflammatory cytokines and promotes healthy gut microbiota. We take the vitamin D from sun ray at least 10 minutes per day from 11 a.m. to 3 p.m. We can take the sunlight, and also the fermented ghee, also the rich source of vitamin D. Now vitamin E. Vitamin E acts as an antioxidant and radical scavenger which helps in modulating the host immune response in elderly. Vitamin B6, essential immune regulation, reduce cytotoxic activity, reduce inflammation, amino acid synthesis and metabolism. What is the role of vitamin B9? It reduces cytotoxic activity, antibody production and metabolism, and also antibody response to the antigen. And vitamin B12, gut microbiota, T cell production, immune modulator, intestinal immunoregulation. It helps for that purpose. So we have to take every day vitamin B complex also, and vitamin C, which stimulate antibody formation, support cellular functions. Next slide. These are some pictures of vitamin rich foods: vitamin A, vitamin C, vitamin D, vitamin E. We all know that. Next slide. And okay, and for the vitamin C, we amla. Amloki is the very rich source of vitamin C, and any kind of citrus fruit, lemon, we take every day for the vitamin C. We have to take the tablets, but also we can take every day lemon, citrus fruit, amloki is the very good source of vitamin C, and also the guava is the very rich source of the vitamin C. We can take every day in our diet. Now the minerals. Zinc, selenium and magnesium in current situation we have to take every day. Why? Zinc is crucial for the normal development and function of cell modulating innate immunity, neutrophils and NK cells. Macrophages are affected by zinc deficiency. Phagocytosis, intercellular cleaning, and cytokine production all are affected by zinc deficiency. So we have to take in proper amount of zinc rich food like beans, chicken, pumpkin seeds, nuts, lentils, yogurts, oats, all are rich source of zinc. So we have to take this type of food for zinc. Now the selenium. Selenium plays an important role in the health of immune system. This antioxidant helps lower oxidative stress in the body, which reduces inflammation and enhances immunity. For the selenium, we can take every day various type of grains, cereals, dairy products, seafood, fish. We can take every day. Through these foods, we can take selenium. And also the magnesium is a very important, because magnesium helps in the synthesis, release and activity of cells of the immune system, have been reported from in vivo and vitro studies, and magnesium deficiency in animal associated with impaired function of both hormonal and cell mediated immunity. For magnesium, we also get magnesium from pumpkin seeds. This is the very good source of the magnesium, and also the almonds and boiled spinach. Spinach is the very good source of the magnesium, and we can take everyday peanut also. So through this food, we can take the sufficient amount of magnesium. Next slide. These are the pictures of the mineral rich foods. Next slide. So now, what are the herbs and spices for health immune boosting? We can take tulsi as an immunity boosting herbs because tulsi has antiviral and anti-inflammatory properties. It is important to have it on the empty stomach. You can take 5 tulsi leaves along with 3-4 peppercorns and 1 teaspoon of honey to boost your immunity. It is quite effective against headache, indigestion, and anxiety. So you can take tulsi as this form. And also the turmeric is a very good immunity boosting herb, spices. A super spice having powerful medicinal properties, increase the body's antioxidant capacity and also the anti-inflammatory effect. Include turmeric powder in your everyday curries and teas. But one thing is very important. Turmeric is helpful for the immunity boosting property, but don't take in huge amount. Everyone think, everyone take everyone take lots of turmeric powder in milk, in water, as a good source of immunity boosting, but don't take it. Excess amount of anything else have harmful effect. So what we are adding our curry or any kind of sabji, that is sufficient for us. So don't take lots of turmeric powder. Next. And also the black pepper, ginger, red pepper, clove, they are also very good source of antioxidant. Like black pepper contain flavonoids, ginger, gingerol, red pepper, capsaicin, and clove, eugenol. You can take every day through your sabji or curry, that is also added in the sabji. Okay. Next, look, avoid above spices act as an antioxidant and also the flavoring agent, which helps to improve our immune system and food palatability. Next slide. Now, this is very important. Prebiotics and probiotics. Prebiotics and probiotics both support the body in building and maintaining a healthy colony of bacteria and other microorganisms, which support the gut and aid digestion. These food companies help to promote beneficial bacteria by providing food and creating an environment where microorganisms can flourish. So, for prebiotics like garlic, barley, onion, banana, oats, pearls, flaxseed, wheat bread, from these foods we can take prebiotics. And for probiotics, we can take fermented milk, yogurt, fermented food products like that. So if you take every day 100 to 150 gram of curd, homemade or purchase it, that is very beneficial for your digestion. So you have to take every day curd. And also for the prebiotics, you can take the garlic, onion, banana, oats, apple, flaxseed, and wheat bread. Next slide. Now, this is the very important thing. What are the cooking practice? Cultural factors play an important role in dietary factors. So, faulty food beliefs and practices adversely affect nutrition and health. Cooking renders food palatable and helps in easy digestion. Cooking destroys harmful germs, and also faulty cooking habits lead to loss of nutrients. So you have to do the proper cooking habits. Cooking at high temperature leads to destruction of nutrients and formation of harmful substance. If you cook at high temperature, protein lost, all type of vitamins and minerals are lost. So you have to do the cook in low temperature. You have to do that. Next slide. So what you will do and what you will not do. So first, do not wash food immediately before cooking. Don't wash. Again and again, this is not good for the nutrients. Do not wash vegetables after cutting. Before cutting, you do the wash the vegetables properly. Do not soak cut vegetables in water for long periods. We all know the water soluble vitamins are lost due to this way. Do not discard excess water left over after cooking. Cook foods in vessels covered with lids. Always cook with lids. Prefer pressure or steam cooking to dip rather deep frying or roasting. Encourage consumption of sprouted and fermented foods. This is very beneficial for us. And don't reheat the leftover oil repeatedly. This is not good for us. This is carcinogenic. So don't reheat the oil repeatedly. Next slide. Now, if you suffering the dry cough or sore throat, you can use this. First, steam inhalation with fresh pudina leaves or ajwan can be practiced once in a day, or clove powder mixed with honey can be taken 2 to 3 times a day in case of cough or throat irritation. These measures generally treat normal dry cough and sore throat. However, it is best to consult doctors if these symptoms persist. Then, if this is the homemade things, if you not cure this problem, you should consult your doctors. Next slide. So, what we remember always, sun exposure for 15 to 30 minutes minimum between 11 a.m. to 3 p.m. every day. Stay hydrated. Drink 10 to 12 glasses of water per day. If you don't take the water as a fluid, then you can take various kind of soup and liquid things like milk, dal butter, and lassi. You can take this way, but you stay hydrated. This is very beneficial for you. And be active, do physical exercise or yoga daily. Don't compromise on sleep. This is very important. Dr. Bhadra already said at least 7 to 8 hours is the best way to help your body build immunity. So you have to take 7 to 8 hours sleep in a day. Distress yourself, meditate yourself, and avoid smoking, alcohol, and other addictive substances. And also take the proper balanced diet. So, in this way, you can stay fit, stay healthy. Thank you. Thank you so much, ma'am, for sharing such valuable information and guidelines with us. Now we have to move towards the question answer session as we are already getting incredible number of questions which I like to present to you, ma'am. May I? Yes. Okay. For you, the first question from Debanjana Mondol. Ma'am, what's about the herbal remedies as immunity boosters? As it is not possible for everyone to take zinc and HCQ. And if so, please tell us about the kind of herbal remedies to be taken. Okay, I think you must listen my full presentation. Through my presentation, the herbal rich food like tulsi and all kind of spices like turmeric powder and cloves, cardamom, any kind of spices you have to take every day through your sabji vegetable like that. Don't take it. Don't take it a huge amount for your immunity boosting. Through your sabji and vegetable, you can take in sufficient amount. Now your next question is again from Debanjana Mondal. If a person having obesity and having pressure related and CVD problems, then what will be his or her diet in the pandemic situation? In pandemic situation or not in pandemic situation, they have to follow the proper diet due to he or she suffering from obesity, CVD, and hypertension. she or he consult with any dietitians for the proper food habits and proper menu planning. Okay. Again, a question for you. Flaxseed may cause inflammation in people with GI disease. If flaxseed is still administered in small quantity, will it still cause inflammation in them? And one more related question is there. Can chia seeds and flax seeds and pumpkin seeds be beneficial for boosting immunity? Can I repeat the question?
Yes, yes.
Okay. Can chia seed, flax seed, pumpkin seeds be beneficial for boosting immunity?
Yes.
And the previous one was flaxseed
And these
may
are
cause.
antioxidant rich. These are antioxidant rich. So everyday diet we have to take this type of seeds. And if he or she have some problem in these seeds, don't take it.
Okay.
But it's are the antioxidant rich we should take.
Yes, ma'am. Then the next question for you. Can COVID infected mother breastfeed her newborn baby?
Yes.
Okay. One more question for you. Does probiotic give protection against COVID-19 infection?
Yes.
Okay. Next question. Is there any benefit of taking vitamin D supplement to prevent COVID-19? Is it safe to take it?
Yes. Dr. Bhadra already said.
Okay. One more question. Is it safe to take green tea in empty stomach?
No. Don't take green tea in empty stomach.
Okay. Your last question, ma'am, from Sanupa Siddiqui. Ma'am, can you please suggest a substitute of curd for a sinusitis patient? For a cyanotic patient?
Milk and milk products are helpful. If you're not comfortable with yogurt, then you can take chena, paneer, milk. You can take it that way.
Okay, thank you so much, ma'am, for gracing the webinar.
Thank you, Madhumanti, and thanks to all the entire team. Thank you.
Okay, now we will move towards our third and last technical session with another honorable speaker, Dr. Professor Dibyendu Mukherjee, the renowned medical consultant in Kolkata. He is a professor of medicine at KPC Medical College and Hospital and also a consultant of medicine and rheumatology at Fortis Hospital, Anandapur, Kolkata. Having 23 years of clinical experience in his field and several national international publications in his credits. In recognition to his contribution in the field of medicine as an undergraduate and a postgraduate teacher, a clinician of repute. He was also awarded the Fellow of Indian College of Physicians in 2018 and delivers lectures in several national international forums over the years. Apart from his professional excellency, he is an ardent nature lover. And as an avid trekker, he has already completed several treks in the mighty Himalayas. A warm welcome to you, sir, and now handing over to you.
Thank you. Thank you very much for this introduction. And today we.
Sir, may I present your slide, sir?
You might. Please. Is it there?
Can you see, sir?
Yeah. Thank you. Thank you very much.
Okay, sir. Thank you.
So today afternoon we are having a seminar, a webinar rather, on COVID. And as of now, the present data shows that India already has 21,56,756 COVID infected patients. Many of them have recovered. and the world data shows that around 7,30,151 people have already died of this disease. So it's a pandemic, we all know. It first started, a brief introduction to COVID. It all started in December 1919 when the first case was reported in from China. It's caused by a virus, which is a coronavirus, which has been named as the novel coronavirus or the SARS-CoV-2. It has already been said in details by Dr. Bhadro, and his speech has practically made my job much easier. I have nothing more to add to it. Just recapitulating on the salient points. This is a disease which is caused by droplet transmission. So that means when we cough, when we sneeze, when we talk loudly in front of someone, the droplets which come out from our mouth, those carries the virus, and that goes directly into the respiratory tract or the mouth of the person who is in front of us. That is what you meant by droplet infection. And these droplets containing the virus can settle on the surface of other materials, and after touching those surface, if we put our hand into our mouth or we touch our eyes with unwashed hands, we can get infected from these droplets. So mostly this is like an influenza virus. So, like all other influenza, it produces a mild disease in most of the patients. In around 10% of the patients, develop respiratory symptoms, and requires hospitalization. And around 2 to 5% of the people all over the world, in some statistics shows around 10% of the people who were infected died of the disease. So, the treatment, practically, specific treatment, we don't have much of specific treatment for this disease. We laid more stress on symptomatic management, maintaining the oxygen saturation of the person, dealing with whatever symptoms they have, trying to maintain the vitals of the patient properly so that they can tide over this crisis period until the virus ill effects from the body goes. That is our prime motto of treatment. So when we don't have much in our armaments, in our medical armaments to treat the patients or specific treatment for this disease, so what we may mostly stress on prevention of the disease. So the next slide, please. Next slide. Can we go to the next slide, please?
Yes.
Yeah.
Yes.
Thank you. So, when do we suspect that we might have this disease or we might have acquired this virus? So, the presenting complaints are, most common is the fever. Usually, it's a high-grade fever. I think the slide is the slide there. Is the slide there?
Yes, sir.
I can't see this part.
Sir, please go to the screen and pin on the slide.
Yeah, I'm doing so. Suddenly it vanished. Let's see.
Everyone can see the slide, sir. But
Suddenly I can't.
Yes, suddenly it vanished from the screen.
It was visible, but suddenly I can't see the slides anymore.
Same with me, same with the speaker.
one second.
The speaker is very presentable, so we don't mind, but the slides should be visible.
Yeah. Something more than me on the screen. Let's see if I can do something about it. my side.
Sir, I am sharing again and it is visible to all now.
That's it. Now it's visible.
Yes, it is visible.
Yeah, thank you so much.
Okay, sir.
So,
Thank you.
fever, as I was going through, as I was explaining, the fever is one of the cardinal symptoms, the most common symptom. It usually presents with a high grade, but many of them present with a low, or even they do not present with with fever at all. Cough, expectoration, running nose, these are the other very important symptoms. Patients feel very fatigued. This is a very important aspect of this disease, I would say. And in the later stage, they present with a shortness of breath, with rapid breathing, that in medical term we call it tachypnea. They can present with aches and pains all over the body, like in any other viral fevers. Anosmia, loss of sense and loss of taste, loss of smell and loss of taste are two of the very new added symptoms in this spectrum of the disease. Headache is one of the presenting complaint. Many patients present just with diarrhea and abdominal pain. Vomiting does happen, but it's not that common, but it does happen. Some present with conjunctivitis and even rash like any other viral fever. So this, if any of you present with or have these sort of symptoms, so that raises a suspicion that you might be having or you might be suffering from this disease. But you should also know that around 80 to 85% of the patients don't have this infection, do not have any of the symptoms. I think the slide is again malfunctioning.
Sir, we all can see the slide very clearly.
Okay. I'm seeing only the first slide. Anyway, just
I can also see the first slide only.
yeah, something.
Is it?
Yes. What's happening?
One second,
It,
sir.
it doesn't seem to be a problem in our terminals.
No.
Again, we come to the first
Now?
slide.
Now,
That's
sir?
fine.
Okay.
Stop. So most of it, as I was telling, many of the patients many of the people do not have all these symptoms. They can be an asymptomatic uh, COVID infection as well. So these patients actually are the carriers. So we are much more concerned of this group of people. We, as clinicians, we can catch hold of the people who are having the symptoms. We can treat them. We can come to their aid. But the people who are asymptomatic do not come to the physician. They also don't know actually what they are suffering from. They go on spread from person to person. And that's what in a pandemic. That is what is scary. Now, who are the people who are at risk? So most patients do, as I've said, many of them are asymptomatic, many do not develop much of symptoms, or mildly symptomatic. But some patients are at very risk and develop a lot of morbidity and mortality from the disease. They are especially the elderly group of people above the age of 60. 60 is not a benchmark or just a certain line above 60 and below 60. It is an elderly patient, elderly person usually have a more prone for getting severe infections, severe disease, severe manifestations of disease. Obesity is one of the single most important uh, uh, risk factor, I would say, because a obese patient, when he catches this COVID infection, the chances of having respiratory problem is much more with these sort of people. And if they land up on ventilators, they have a very high mortality rate. So obesity is one of the very important risk factor. Any patients whose immune status is altering or has suppressed immunity, or patients who are on chemotherapy, radiotherapy, who has undergone some organ transplant like liver transplant or kidney transplant, or patients who are suffering from various malignancies, patients on steroids or other immunosuppressant drugs. These patients are at even a higher risk than the general population. Diabetics, as we all know, have a higher risk. Patients having cardiovascular diseases, mostly hypertension, coronary heart disease, have a higher risk than the population. Pre-existing lung conditions like chronic obstructive lung disease or other congenital heart diseases, lung diseases like cystic fibrosis, patients having interstitial lung disease, more chance of having severe diseases than the kidney disease, and especially we protect kidney patients who are on hemodialysis or peritoneal dialysis. They stand a much higher risk than the general population. Can we move to the next slide, please?
Yes, sir.
So, as I've already told, I already said, important thing, we should target on that. So Dr. Bhadra already explained everything, what to do. I'm just recapitulating on the point. Social distance. Maintain a safe approximately 6 feet away from your nearest person. When you're talking to a person, have a distance of around 6 feet. Avoid overcrowding in a place. Public transport, we have to be very careful. We don't have to, we should avoid overcrowding buses and transport systems. When you go out in a common space, we should be very careful not to move around in a group where we don't maintain the social distance. So social distance, a terminology into our vocabulary, every day in and out, we are listening to this social distancing, and we should not only listen to it, we should practice it. That's what I mean to say. Wearing of mask is very, very important. And wearing of mask in a proper way. That is again very important. So when you put on a mask, the mask should be properly fitting one. It should cover your mouth and your nose. There should not be gap around your nose so that your breath goes out from there. I know it's very difficult for people who put on mask. So they usually tend to pull it down and pull it below the chin, because putting a mask over the chin is of no help. So put the mask the proper way, and whenever you put a mask, try not to fidget with it. Try not to put your hand over the mask and always adjust it. This is a very bad habit. So if you tend to do this, you have a habit of always putting it with your mask impermanently. So what I can suggest you can put on a face shield in front of your mask so that your hand does not go and touch your mask. So wearing a mask in a proper way is very important. What sort of mask? Well, the social media, the news, and everyone has discussed in proper details about it. Preferably a 3-ply mask, surgical mask, or the N95 mask. Those actually N95 is for the health professionals, or when you people go to a hospital or go to a place where there are COVID patients, or you have COVID patient at your residence who are on home isolation. In those cases, definitely I would suggest to put on the N95 mask. For the rest of the time, you can put on the brain surgical mask, and that's going to do if you can maintain the proper other aspects of preventive measures. Next slide, please. Hand washing is the most important thing. You should encounter this hand washing as frequently as possible, and that each section should be of around 90 to 120 minutes. That is 1.5 to 2 minutes. Following all the steps of hand washing with soap. Any soap is going to do. Don't have to go branded soap for hand. So have a proper hand washing done for 1.5 to 2 minutes in a running water, followed by sanitizer, using a sanitizer. If at all you can't go for washing that frequently, you should always carry a sanitizer with you, and at least sanitize your hand as frequently as possible. And again, Some I've seen people putting on gloves, and well, gloves is very important for your own protection. But putting a glove for hours together and not washing your hands is again a deadly thing. You are putting on a gloves, and with that you're touching every places. You're not washing your hands, and with that gloves, you're fidgeting with your mask, or you're putting your hands over your face, and that is going to cause infection to you. It's not going to save you. It's not. So putting gloves is of no use unless you follow the steps of hand washing as you do without putting the gloves on. So next slide, please. Again, very important is the daily things you use, like the specs you put, the keys you carry, the ornaments, the bags, the umbrellas, the things you carry day in and day out with you, your purses, your wallet. You should try to disinfect them at least once or twice a day with proper disinfectant. So this is again very important. We tend to follow. We wash our hands, we wash our mouth, we wash our face, but we do not wash our spectacles daily. We don't. We forget to clean our mobile phones daily. We forget to disinfect our bags daily. So these are potent sources of infection. Again, if you go out, when you come inside your house, remember not to reuse your clothes. The clothes which you go out with, when you come in, take off your clothes, put it in a bucket of water, preferably warm water, or in some detergent water, and keep it for some time before washing it. So don't reuse your clothes which you are wearing on. And another very important thing, after you reach home, have a hot scrubbing bath. Use ample amount of soap and shampoo if possible. So these are very important thing, that so that you don't carry the disease home. And we as a healthcare professionals are more at risk of catching these diseases. So a healthcare professional should be careful about it. And one more thing I definitely warn everyone is to leave your shoes outside the door or your main door. Don't just walk inside your room with the shoes you wear outside. So keep the outside your room, open your shoes, and then enter the room. These are some of the 8 old traditions of India. This is the time we should follow them. It's fact. Next slide, please. So this is about prevention. Now, if you are exposed or if you develop symptoms of the disease, what to do? First and foremost, do not panic. Panic is not going to help. So if you have symptoms or if you are exposed, to isolate yourself from rest of your family members. That should be number one. Consult your or a video consult or visit physically if feasible. Explain everything to the doctor, and he or she will be the best person to help. He is going to guide you to have the COVID test, the swab test, the RT-PCR test, or you can go to a few clinics which are open throughout 24 hours, many places, many hospitals, and in many government setups. To go there, explain your symptoms, and have yourself tested. After you test, or before you test, until you get the try to isolate yourself from rest of your family members. That does not mean you should go and hide yourself below the bed. No, you should try to be in a room, not mix with other people as frequently as you used to do. Use a mask before going and meeting other family members, use a separate toilet if possible. That's what is meant by isolation. It's not being ostraciated from the society. So, and as soon as you get the results, consult your doctor again. Even if it is, even if the result is negative, this is very important. Even if the result is negative, and you are having symptoms or you had symptoms of the disease, try to maintain that isolation for another before you start mixing with people. Because always remember, this test is not 100% sensitive. I mean, sensitive. That is, whenever, if 100 people have this disease, all the 100 might not prove positive to this test, because it all depends on the timing, the proper procedure, whether you're able to detect the virus from the parts of the RNA parts of the virus in the or not. So there are various factors in it. So if you have symptoms, even if the test is negative, try to maintain the isolation for some days after you become asymptomatic. And about nutrition and medications, I think Dr. Bhadro and my earlier speaker has explicitly explained to you everything. So only that I can add on, or rather to recapitulate on those things, I would tell to have plenty of water, take vitamin C, vitamin D, and micronutrients, minerals like zinc and magnesium. Have the tablet of paracetamol with you, but do not self-medicate or hold other drugs. And one important message to all of you is have a thermometer and a pulse oximeter, if possible, at your residence. This is going to help you throughout the pandemic times. Next slide, please. Oh, that's it. So that's all I had to had to say, and I would be rather happy to invite the questions, if any.
Thank you so much, sir. This session is really informative and full of learning for us. Now we have to move towards the Q&A session as lots of chat box questions are there. So the first question for you has been asked for multiple times. Is COVID-19 infection is airborne?
Well, if I'm not here to tell my opinion, but as of now, whatever the very authorities have said, it is a droplet infection. I am not going to comment on whether it is an airborne or not, but it is a droplet infection as of now.
Okay, this is a very specific COVID-19 question. What are the alarming symptoms of COVID-19 for a comorbid patient?
So, as I've already said in one of the slides, I've explained, I've shown you what are the symptoms of the disease. So, fever is one, cough, respiratory distress, running nose, conjunctivitis, loss of taste, loss of smell, body ache, aches and pain all over the body, smelly, severe weakness. All these are symptoms. It does not mean you are going to have all this at the same time. You can have one, you can have many of the symptoms at the same time. And it is same for everyone, whether comorbidities or not.
Thank you, sir. Now, the next question is a very common one. Does asymptomatic patient transmit the disease?
Yes, they do. Asymptomatic patients definitely go on spreading the disease, and that is the reason we have to be very careful when we go out in the open. We should protect ourselves and protect the community from spreading the disease. So that's why the mask, the social distancing, and so on and so forth, all the terminologies have come.
How long a COVID infected person do transmit the disease?
Well, on an average, or the mean time is around 10 to 11 days from the onset of getting the infection. So that is the thing. This is the mean time. That does not mean after 10 days you are free and you're not going to transmit the disease. It all depends on the viral load inside your body. If the viral load is high, you have a tendency to spread it even beyond 10 days. And that is the reason why ICMR has recommended that after 10 days of hospitalization, you go home and remain in home isolation for another 7 days before mixing with other people.
Okay. Can the virus infect single person for more than one time?
It all depends on the immune status of your body. So actually, when in any, it's like any other disease. When the disease affects you, any viral disease, the body tends to produce an antibody against it. That is the basic mechanism or the basic pathophysiology of how the vaccines help. So as long as the the immune system or the antibody level, the antibody IgG we call it, is there in a proper titer inside your body against the COVID infection, you are not going to be reinfected again. But whatever we have seen so far, that remains active for about 2 months. So on an average, after a COVID infection, you for the next 2 months you tend to be immune to the disease, but after that you again are susceptible to the disease because this IgG it does not remain for a lifelong in your body.
Sir, what kind of mask is important for a normal person? A safe surgical mask or a mask with valve?
Well, a mask with a valve is not recommended in any place, because when you have a valve, if you have the disease through the valve, you're going to spread the disease. It's going to go out into the atmosphere. It is a one-way valve, and the valve is only important because if you do some physical labor putting on the mask, in that case the valve is important, that because that allows the expiratory air to go out. But preferably for preventive purpose and for decreasing the spread of the disease, I would recommend a mask without a valve.
Okay. Sir, now it's an interesting question. Willow roots is known to have medicinal benefits. Will it also help in boosting COVID-19 prevention? Giloy roots is known to have medicinal benefits. Will it also help in boosting COVID-19 prevention?
I'm not the right person to answer this. I think the nutritionists are in a better position to answer those.
Next question for you. For how long does coronavirus stays active on unanimated objects?
There are a lot of speculations, I would say, but it depends from surface to surface. On plastics, it remains for a longer time. On wooden surface, for a shorter time. So, on an average, it remains in whatever surface it is. It remains active for a maximum duration of around 6 hours, not more than that.
One more question from Sanufa Siddiqui. Is it true or just a myth that the virus spread faster in an air-conditioned room?
Well, the concept is in an air-conditioned room, we recycle the air. The same air has been recirculated inside the room. So if anyone has a COVID infection or anyone spreads the infection into the air, that is going to be recirculated inside the room and going to infect all the people. That is the concept. It is not the air conditioner or in the open air. If the thing is very simple. If it is the open air, the air will drive the organism and spread it to make it at a distant place so that it renders it harmless to infect again. So air conditioned rooms have a recycling of the air. So if it has a negative suction air conditioned room, that is not going to spread the disease. So all ICU where COVID patients are being admitted, all wards where COVID patients are being admitted with an AC vent, in the hospital they develop a negative suction. So in those settings, they don't reinfect again. I think I'm clear.
Yes, sir. Is the immunity for a recovered COVID patient lifetime immunity,
No,
or are there chances of occurrence again? Again, I think the same question.
yeah, I've already explained that.
Okay.
The immunity does not remain for a lifelong period. It just remains for an average of 2 months. But it depends on how much IgG you are developing to the infection.
Okay, thank you so much, sir, for addressing all the questions with immense patience.
Thank you, thank you. Nice having attending this webinar. I think it has been useful for the common people, for everyone, and I'd be happy if it has helped anyone. Thank you so much.
I like to thank all our dignitaries for gracing the webinar today. We are still getting multiple number of questions, but extremely sorry we couldn't manage that much time to address them all. I'm requesting Dietitian Malavika Datta, if possible, ma'am, can you give the answer in the chat box regarding the previous question, how giloy roots are beneficial to prevent the COVID-19? How giloy root, how giloy roots, it's a herbal plant, it's a herbal plant, how giloy root is beneficial to prevent the COVID-19. Giloy, Giloy. I can't understand that. Even this question is very new to us.
Yes.
Yeah, it's a herbal plant, man. If possible,
Okay.
can you please give the answer in the chat box
Okay, I will try.
later? Okay, ma'am. Thank you. Regarding the feedback form link, it has been already shared in the chat box below and in the webinar WhatsApp group. Now the link will remain active till 5 p.m. tomorrow, 10th August. Therefore, I am requesting everyone to give their valuable feedbacks to us. Now we will move to the Thanksgiving session as the webinar has already come to an end, and here I am requesting the senior most faculty of our department, Dr. Oshima Ghosh, to give the vote of thanks.
Thank you, Dr. Good evening, everyone. I feel extremely honored and privileged to express my sincere gratitude and extend vote of thanks on this auspicious occasion. I would like to thank, on behalf of our Food and Nutrition Department, S.A. Jayapriya College, our respected Principal Sir, Professor Ashok Mukhopadhyay, for his constant support. I extend my sincere thanks to the renowned epidemiologist, Professor Dr. Uchchal Kumar Bhadro, for his excellent lecture, which has immensely enriched us. I would like to thank the well-known dietitian, Mrs. Malavika Datta, for educating us nutritionally in COVID scenario. I would convey my thanks to the eminent consultant, Professor Dr. Dipendu Mukherjee, for sharing his practical knowledge regarding how to arrest and fight COVID infection. My sincere thanks to the convener of Internal Quality Assurance Cell of S.R. Jayapriya College, Professor Dr. Radhanath Pai, for his extreme encouragements. I would like to acknowledge our respected TCS Madam, Professor Rekha Singh, for continuously guiding us to make this webinar success. I would like to thank the other members of IQSC team, especially Dr. Ilashish Pal, Dr. Shudeshna Shao, Dr. Gargi Basu, and Professor Devraj Roy for their continuous cooperation in organizing these webinars. Last but not least, I would like to thank all participants, our colleagues, especially students, for their patient hearing. Once again, thank you all our beloved speaker for giving us your precious time and valuable suggestions. We sincerely hope to overcome this great situation and create a corona-free world in near future. Ending this webinar, Namaskar.